Hello, I'm Claire.
And I'm Lizzie, and we're pelvic health physiotherapists.
In this section today, we are going to talk about different postures that we may find ourselves in every part of daily activities. So we're going to go through sitting, standing and kneeling postures. And really, it's really important to consider that when you are pregnant, we have got to keep changing our postures. So we do not want to be in one posture for too long. So we would advise that you change your posture every 20 to 30 minutes, and we'll reiterate that as we go through the video. So firstly, you may come in from a day at work or a busy day with the children, and you slump on the sofa. And you may find yourself in this sort of position where you're leaning over to one side. And as you can see here, all of Lizzie's weight is down through that right side, and her pelvis is actually quite twisted, and the weight is unevenly distributed. So what we've got to consider is that the joints and the muscles are going to be unnecessarily loaded, and this tension can then creep up and start to cause some pain and add to your symptoms. So to get into a good posture, if we turn Lizzie to the side, we have to consider how to actually put our back in a good posture to start with. So we don't want one extreme where we're slumping down, and that's a rounded spine here. The chin starts to poke forward and the shoulders also drop forward. And that's a common posture that we can find ourselves in when we've been working at the desks and the laptops, and then we start to work on the keyboards. And we have a lot of muscle tension that will develop in this position. Equally, we don't want to go to an extreme posture, thinking we've got to be bolt upright. So this is only going to increase that lower curve that's already increased in pregnancy. So we really do want a halfway place. So we go from a slump to an overarch, and then find somewhere in the middle. This is what we call neutral posture. And that is our ideal place to be. So Lizzie, if you get your bottom in the back of the chair now, a way we can help support that posture is just to get a rolled up hand towel. You can then put a couple of hair bands either side to keep it in place. And this just goes waist level in the back of the chair. So you'll find that the lower part of the pelvis is supported nicely, that Lizzie's shoulders are more relaxed, and her head is in a better position now. So in this position, we then need to think we can use it for driving, we can use it for the end of the day, maybe bring a dining room chair into your main living room area. And if you think about the driving, you've got the driving and the steering wheel, and you've got your rear view mirror here. So if you set your rear view mirror so you can see out the back, you've got a clear view. Often what tends to happen, you'll be driving for 20 or 30 minutes and you start to slump. You'll look in the rear view mirror, not see the same view, and it will prompt you to then come back up into a good sitting posture. So we're going to talk about going from a sitting posture into a standing posture. And what's really important to recognise is that you have to keep changing these postures frequently. We don't want you to be in one sustained static posture for too long. So for every 20 to 30 minutes, you do need to be getting up, moving around your home or your workspace or your office, and then sitting back down in a good posture. When you have been sitting for a while, sometimes it's really useful to do some pelvic tilts just to loosen up the joints and the muscles, to increase blood flow and circulation, and that's just going to prepare the body for that movement. So after Lizzie's done a few pelvic tilts, she should feel that her spine, her pelvis is feeling a little bit looser and ready to go. So when we are going from sitting to standing, we've got to consider a few things. The feet need to be tucked backwards and the shoulders need to lean forward. But the most important thing, use your pelvic floor muscle to brace up as you change that position so that it's really adding support to your pelvis. So, Lizzie, as you lean forwards and come up into standing, pull up your pelvic floor and come up into standing. That's beautifully demonstrative of how we should get up from a seat. So Lizzie, if you don't mind sitting back down, some of the common ways that people can move from sitting to standing when they're pregnant because of the bump at the front is it puts more strain through the pelvis. So Lizzie, going to demonstrate often leading with the bump, and if you go back down, or putting excess weight through one side of the body. So these postures are not helpful for your pelvic girdle pain and for the pelvis. So if we just demonstrate one last time, Lizzie, a good way of going from sitting to standing. We are leaning forward, bracing up with the pelvic floor, and then we come up into a good standing posture. So now we're going to look at standing. And it's really easy that when you're not pregnant to think about how you used to stand and think, oh, I used to get away with certain standing positions. So when you're queuing in a supermarket or texting, you're on the phone, you can easily go into these altered movement places and postures, and it doesn't cause any problem. But when you are pregnant and you're then loading one side more than the other, your joints are going to start to grumble, and that's the muscles becoming tight and the joints are loaded more on one side than the other. So what we have to consider is when you are pregnant, you've got to look after how you stand. And coming up into the middle, making sure that you've got even weight between both of your feet, left to right balance, and that front back balance. So it's almost like having a piece of string coming up through that pelvic floor, up through the centre of the spine, out the top of your head. And if you come up by just a centimetre from the bottom, you will feel your pelvic floor lift up, and your lower tummy muscle here may pull in underneath your baby, your bump, and it will just draw in a little bit. And this is a really nice, strong way to stand. And if we just turn Lizzie sideways, if we think about that nice tall piece of string, it's also important to think about the glutes, the gluteal muscles around the back. Gently tuck under and squeeze to stay nice and strong. So we're really trying to think of an active, strong posture here. The glutes are working, and the lower tummy muscle is working around the front. What we do find a nice thing to do is to move as well in standing. So we can do some pelvic tilts in standing. So again, Lizzie's demonstrating that if you're in a supermarket queue and you can't move, or you need to move in between meetings, you can then just stand and do your pelvic tilting exercises to free off the muscles and the joints. So we're now going to talk about positions that we can get in on the floor and the helpful positions and some of the postures and places that you may find that you have to be if you've got toddlers or you're trying to change your baby, and you've got to be on the floor at some points of the day. So often an unhelpful posture would be going to the side, where you have again all the load going through one hip. So the right hip is being fully loaded, and this left hip here is lifted up, and those back muscles are going to be working in very different places. And if you're holding these positions for a long period of time, the muscle will increase with its tension and contribute to feelings of pain. The other place, if you specifically have pubic bone pain, sitting like this for a prolonged period of time can really increase the stress and the strain through the pubic bone. And the muscles into the inner thighs attach onto that pubic bone. So we don't want to have that pulling effect and that increased tension. Another place people will often find they want to go into is legs straight. Some people may find this is comfortable, but again, what we're saying is for a long period of time, your hamstrings are perhaps going to get a long strain and pull, and the back of the pelvis has to start to slump down. So ideally, if you are spending time maybe at a play group or changing a baby's nappy or a toddler's nappy on the floor, what we can do is to use some pillows. And if we go into a kneeling position and get a couple of regular pillows, put them between the backs of the legs and the buttocks, then we can see in this position Lizzie's pelvis is nice and balanced, it's nice and even with its weight, and there is no twisting or straining on the pelvis. And then Lizzie can actually relax in this position to bend forward to then be doing any activities down here that she may need to work with.